I'm Cris Duval, and I'm the hygienist at Advanced Cosmetic and Laser Dentistry in Seattle, Washington. And this is Chris's Corner. What I'm going to share with you today is probably one of the most important aspects of visiting the dentist or seeing your hygienist, and that's an oral cancer screening. We now know one person dies every hour of every day from oral cancer, and it's a needless death. If oral cancer is detected early, it can be cured. So I'm going to show you how I do an oral cancer screening here today. Can you open and close nice and wide for me? Good. Now go ahead and close. Tell me if you have any sensitivities when I'm checking out different areas. Great. Turn your head away from me. I'm looking for any lumps or bumps that might be underneath your jaw on either side. Great. Now I want you to swallow for me. Perfect. I'm just going to check around the back to make sure that there aren't any lumps or bumps that shouldn't be there. And this is a very important part of your oral cancer screening, and that's an extraoral screening on the outside. So now let's look inside. So I'm going to look at all the external tissues, the lips, make sure that there are no lesions or anything on there. Then I'm going to look inside his mouth, check out the cheeks, and then I'm going to have you say a big "aw" for me and hold it for a second or two. Aww. Perfect. What I'm checking is back around the tonsillar pillars and at the base of the tongue, because we now know even if you haven't used tobacco of any kind or combined that with alcohol, you're still at risk for developing oral cancer, because the human papillomavirus causes oral cancer around the base of the tongue and the pillars of the tonsils. That's why I looked back there very thoroughly. And stick your tongue out for me now. I'm going to check both sides of the tongue. Look for anything that is not normal. Now put your tongue on the roof of your mouth for me. Great. I'm also going to feel underneath the tongue on both sides, and now stick your tongue out for me as well, because we now know that you just can't look at the tongue, you have to feel as well. Things hide inside the tongue. Now go ahead and relax your tongue. Everything looks terrific in here. What I'm going to do now is I'm going to use an advanced piece of technology called the Bellscope, and it's going to look past what I can see, look beyond what I can see down to the basement membrane layer where all the cells come up from. So this is a very important part of your screening. Okay. Turn your head towards me. Now what I want you to do is relax your tongue and give me that big "ah" again for a moment. Perfect. Now stick your tongue out at me again. Good. Look at both sides. And put your tongue on the roof of your mouth. That's great. Everything looks terrific in there. One of the things that I'd love for you to do for us today is when you leave here and go back to work, I'd love if you would tell your family and friends, people that you love and care about this oral cancer screening that I did for you today. Have them request it. Ask them if it's not being done, have them request it, because it can literally save the life of someone you love. Will you do that for us?
I will.
All right, thank you so much. This is Cris Duval, and this is all for Chris's Corner today.